There are so many different specialties that PAs and NPs can go into. And today we're going to dive into the specialty of pediatric neurology. You may wonder, God, is it horrible working with pediatrics, or is there something special about pediatrics? And then what do PAs and NPs do in neurology, and can they subspecialize? The answer to that is definitely yes. The PA that I'm interviewing today works in pediatric neurology already, a smaller specialty, but she even subspecializes further than that and works almost exclusively with pediatric epilepsy cases. It's really kind of fascinating, the mixture that she has in her job, the autonomy, and all the different things she gets to do. So, if you're interested and want to learn about what it's like working in pediatric neurology, then you're going to want to stay tuned. Hey, it's Michelle with the Medicine Couch. Thank you for joining me as always. I really appreciate it. And I'd ask you a favor, if you like this video, if you think I bring you good content, please hit the thumbs up button and consider subscribing to the channel. But more importantly, if you know colleagues and friends who would like this video and could benefit from it, please share it with them. I'd really appreciate it.
Hello, my name is Olga, and I work in pediatric neurology. I've been working in this field for about 7 years.
Thank you for joining us. Would you tell us a little bit about your career path from PA school? Like, did you work in any other specialties, or did you go directly into this?
Yeah, I went directly into my specialty, but before that, I had a little different career path. I graduated Masters of Acupuncture and Oriental Medicine, then worked in non-traditional medicine, and then moved towards traditional path.
Oh, yeah, that's really interesting. Was there something about what you had done before that kind of made you interested in neurology, or that kind of led you into neurology?
I don't think that at that time I thought if it's going to be neurology or not. I think I fell in love with medicine and taking care of patients. That's how I kind of started moving forward, and I wanted to learn more and to know more.
Well, then, so when you graduated, after you went to PA school, what was the reason that you ended up in neurology?
So the way it happened was interesting because originally I actually wanted to be in surgery, and my favorite rotation was neurosurgery, pediatric neurosurgery specifically. So yeah, at that time I was like, okay, maybe I'll do pediatric neurosurgery. So I was asking around, like anybody has anything, and I was applying, but my mentor in neurosurgery, she told me, I know you want surgery, but we have a position open in neurology right here. Would you be willing to apply and to go to interview? So that's kind of how it happened. Not necessarily that I planned it, and then now I fell in love with this, and I can't imagine doing something different.
Yeah, I don't know how many people I've interviewed that have kind of that story as far as like wanted one thing and they were pretty set on it, and just for whatever reason couldn't get into it, and something else fell in their lap and they just ended up loving it. It doesn't always happen that you love it, of course, but I think it's a great lesson for people coming out of school not to put all your eggs in one basket and say, I'm only going to do this one thing, because you really don't know, right? Until you work in something, how you're going to like it. So,
The biggest thing that I learned is that what matters is your environment, right? Like who you work with. Do you like
yeah.
your attendings? Do you like the environment? And then it kind of goes from there. So maybe I would be as happy in neurosurgery if I liked my team. But yeah, at this point, I
Yeah.
love my team.
That is a good point, that it is important to like the specialty that you're in, but you could love the thing and be in a terrible environment and you just be miserable. So that's equally as important, probably if not more. Okay, so you say you're working in pediatric neurology. Do you have like a focus, a particular focus in that, or do you just see all general neurology?
So we do have specializations. I'm specifically epilepsy. And then we have other specialties like movement disorder, a tuberous sclerosis clinic, autism clinic. And then we have general neurology where they see like mostly like headaches or, some other things that are not epilepsy. But epilepsy is probably 70%, if not more, of in neurology. So I think they will see the majority of patients.
So when you specialize like that, what does that really mean? Like, are you having clinics that are specifically just epilepsy, and are there surgeries and things that you're in on that? Do you guys meet and have interdepartmental meetings like tumor boards? So can you kind of give us an idea what you are doing in epilepsy focused peds neurology?
we see a lot of patients that are refractory to medications. So we see very complicated patients that they can be on 5, 6 medications, and we offer them other options besides medications. So the options are ketogenic diet, then vagal nerve stimulator, sometimes neuropace or RNS, and surgery. And all this depends, like if they're candidates, right? So in the whenever they are not responding to medications, usually we send them for evaluation. We have epilepsy monitoring unit where we send them and then they do evaluation. We're actually trying to provoke seizures there. So we'll do like the opposite. We try to wean them off medications and provoke to see what's going on encephalogram. And then that gives us an idea. Then we do a lot of other testing like MRI. We have like magnetoencephalography. And then we present those patients in epilepsy surgery conference where we have neurosurgeon, we have radiologist, we have all our attendings there, and then we discuss the case and see what's the best option for this particular patient. And then clinics, the epilepsy clinics for me specifically, and for again, we have 5 more epilepsy specific neurologists. Well, actually, I forgot. We just hired NP, NNP, and me. So we have 7 of us that see epilepsy. Even though the new one, actually, he does see headaches as well because he came from a little bit different background.
Okay.
And I also have this one clinic that's specialized, and it's specialized for neuromodulation because we do have these devices that need to be adjusted. And also, I have a specialty ketogenic diet clinic where I work with dietitian on ketogenic diet.
So it sounds like you have quite a lot of variety in what you do on a weekly basis.
Yes. So I don't do just clinics. I actually only have a couple of clinics a week. And other than that, I'm responsible for making sure that patients that go from the epilepsy monitoring unit that we send them, that actually they start there and then all the testing is done. We have a tracker where I make sure that these patients actually get presented. And then I write a neuroscience report and then I make sure that they actually followed up. So I'm responsible for all our surgical, or I guess, we still would call them surgical, the patients that get the devices. So I'm responsible for all this patient population, so nothing get lost because it's a process that involves a lot of people and a lot of steps and a lot of waiting.
Yeah. So you have a couple days where you're seeing patients, but are there days that you're just doing all of this paperwork and tracking and contacting patients and people? Is that what I'm hearing?
Yeah, so it's computer work, not paperwork, but
Yeah.
nowadays, but it's
Yeah.
paperwork.
Sorry.
I agree.
I'm old
It's
school
a
paper.
paperwork. It's paperwork still. Yeah, so it's I guess it's not so much, yes, it's paperwork, but it requires me to call patients. It requires me to call people that are involved in making things happen. So yeah, I'm involved in the whole
Yeah.
process. Okay, is it done? Is it not done? Why? Because my boss, she wanted to have someone who actually knows the whole process and understands and can explain it to everybody why we need what. And besides this, I have tasks. So a lot of patients that I see or other providers see, they have all kinds of needs and questions and requests. And so every day I have tons of tests that I look through. I'm also involved in research. So we have like 3 research projects. Then I'm involved in that and I'm a research coordinator. So then I'm doing that as well.
It sounds like you have a very packed schedule, but it sounds cool that you have some days where you're doing clinic and you're interacting with patients face to face, on one, but then you have days where you're doing all of that necessary prep work and follow up work and things that happened and research and things. So you have some days where you're not necessarily face to face with patients, right? You may call them, but you're not necessarily face to face with them on some days.
So, well, I'm also involved in rounds for epilepsy monitoring unit. So usually I go probably 2 to 3 times a week. Well, I would say sometimes 5 times a week, depending what kind of
Yeah.
patients are there and what I need. But I am participating in rounds because I need to know what's going on, why, and then I
Yeah.
talk to the patients as well, so they know who I am. Again, it's not all day, right? It's not necessarily clinical, but
Right.
it still involves. And another, I guess, face-to-face will be whenever we have patients with epilepsy in ER or in the hospital. Sometimes I'll go around on them as well, especially if it's, our patients.
And so are you based in the hospital, or is this an inpatient job, or are you outpatient and you just go to the hospital a lot?
It's an outpatient. Yeah. So it's
Okay.
outpatient. I have my office and then I go to clinic and then I go to epilepsy monitoring unit and I do sometimes see inpatient patients, but I Yeah, majority of my work is outpatient.
Are you guys close to the hospital though? Because it sounded like you when you go around the hospital,
Yeah, so yeah, we like across the street we have this bridge that goes like
Oh,
from
okay.
actually from my office to there. So yeah, it's right here, thankfully.
So, in your practice, you said there's you and an NP right now, but in other pediatric neurology practices that you may have heard about or know about, do the PAs and NPs have opportunities to work, in the operating room and like are just inpatient? Are there some that are just outpatient, or is it often like a mixture of both in what you have heard in your experiences?
I think neurology, from what I've heard, mostly outpatient, a lot of outpatient. But again, epilepsy, you can have one or the other. So a lot of times they're separate. So either they are inpatient specifically, which I actually was offered inpatient job at the same time when I was offered this one, where they are in epilepsy monitoring unit and then they just take care of those particular patients because it's still a lot. It's a lot of information. It's a lot of, taking care of the whole process. So some of them will work only inpatient, some of them only outpatient. Usually they just separate it. Usually they don't really do both.
Okay.
And as for surgical option, that's neurosurgery. So neurosurgical PAs,
Ah,
which we
yeah.
have, right? So there are like five of them in our institution. So there are five of them, and then they do both. They do outpatient and they do, surgical assistance as well.
What about like procedures in pediatric neurology? Not the neurosurgery, but neurology. Do you guys do any procedures?
I would say my only hands-on procedures, if I can call them procedures, neuromodulation clinic. I have to like ramp up the device. So we have this wand, right? So the vagal nerve stimulator device is here. So I take care of that. And another one is NeuroPace, which is actually in the brain. So that's another device which is really cool because you and the engineer analyze the data and then come up with a plan how to do it specifically with those patients.
Can you just give us an idea of kind of what your average schedule is like?
Say if it's a clinic day, so I usually have clinic in the morning and then in the afternoon I try to catch up with my tasks or finish my notes. The advantage of not having a clinic every day is that if I'm not done with my notes, right, I can still finish them later. And then even though we have a deadline, sometimes you can go behind if if there are other priorities. So I love that. So I rarely
Yeah.
do bring work home. I only do it on occasion if things get too busy and I have something that I know I have to do, usually before the weekend. I'm more worried about certain patients that, might be in need, like that I have to really do something. So usually that's, I would do that on some Fridays, but mostly I try not to do that. So if it's not a clinic day, I go and round. Takes me about half of a day, sometimes less, sometimes more, for rounds. And then after that, I'll come back and look through the tasks, which I usually have quite a lot, and then see if anybody needs anything. Because I forgot to mention one more thing. Like we have patients that have infantile spasms, and those are usually urgent. So if I have anybody like this, that's a whole process. So then I kind of put my attention there. And then Thursdays we usually have epilepsy conference. So then half of the Thursday that's a conference, and another half I'm trying to make sure everything is prepared for that.
So like what time are you usually getting in the morning and usually leaving?
I would say 8 to 5 is typical. Sometimes can be a little bit earlier, sometimes can be a little bit later. It just depends. But mostly that's just a standard.
Because every physician practices a little bit differently. And, there may even be two physicians in the same practice who feel differently about what the correct treatment should be or dosing and things like that. Do you find that difficult to balance working with several physicians, especially when you're in a specialty?
I think in the beginning, yes, I was overwhelmed because I was like, what do I do? Like, I have so much from everybody. And then, but I have like one of the physicians is my boss specifically, and she not just my boss, she's everybody's boss. She's like a head of the department. So she's the main person that obviously tells me and other physicians what to do.
Yeah.
And also, she has a load of patients more than anybody else in every way, is surgical patients and clinical. So I kind of make this a priority a lot of times just because of the load. And then when working with different opinions and different physicians, you learn their character. I have to do this because in epilepsy monitoring unit, it's always somebody different, right? Depend who's on service. So you learn the behavior, what their preferences is, and you kind of work with this, and sometimes there is a little misunderstanding, when one physician thinks one way and another one is another way, and then they don't really talk to each other. They just tell me. Then I'm this,
Oh,
middle person. So like I learned to say, look, just remember I'm a messenger. You guys make your own decisions. So I already
right.
know this person will not like this or this person will not like this. So yeah, you kind of learn this. I think in general, I guess the reason I like it and I don't stress about it is because my whole team, I feel like they really truly care about the patients, and I think maybe pediatrics has to do with this somehow. I feel like, like in general in pediatrics, we like more caring, or maybe
Yeah.
everybody's caring, but I feel like this is the number one purpose. And at the end of the day, everybody just has like the main thing in mind, right? That like, how can we help this particular patient the
Yeah.
most?
Yeah, I can see that. I think just as human beings, we're hardwired to really care for children and to protect them more and to, be probably more invested in it. Talking about working in pediatrics, what are the things that you think are like positives and things you really enjoy about working with specifically pediatric population?
Yeah, that's another thing that I didn't think that I really wanted to work in pediatrics. I actually thought that maybe I don't, since I already had kids when I went to PA school. So I was like, I think I had enough children. But yeah, at this point also, I absolutely love it because kids bring like this joy. They will give you hugs, they will smile, right? They're cute. So that matters. They'll do some things and they're super cute and they'll say something and they'll do something. I think it makes care for these patients more significant, right? And then I also, as a parent myself, I think I really have a deep respect and empathy for caregivers. Most of these parents really, really have such a hard like toll that they have to do so many things, and then just I think working with the whole family and working with children is very, very rewarding. I would say now, if somebody will tell me go work with adults, I'll be like, no, they're not cute.
When we're dealing with adults, a lot of times we as providers can get probably more jaded and we mistrust a lot of, we're always second guessing, like, are they really telling us the truth? And is this really hurting? Are they trying to get out of work? And I've always kind of thought with peds, they're there because they're sick. There's really not very much second guessing as a provider in your mind. I could be wrong, but I think in pediatrics, that whole level of just our kind of jadedness goes away.
Yeah, yeah. And then, some cases come to mind, what we have. So since it's epilepsy, we also have something called like psychogenic seizures, right?
Yeah,
Where we don't see them on EEG. And so adult population has more of that versus kids, even though kids can have that as well. So I would say, yeah, mostly you don't see that in kids. As they get older into the teenage age, that's when you start being like, they start faking a seizure, they start doing
yeah,
things, and again, you have to work with, psychologists and psychiatrists on that. But
yeah,
mostly that's true. You know that like a 5-year-old is not gonna really fake it. Yes. And then
yeah,
another good thing about compliance, right? Most parents, right? Obviously not all, but most
yeah,
parents are very compliant. So that's also,
yeah,
we know they're doing what we're telling them to do most of the time. And so that, that gives us a
yeah.
reassurance, okay, which route we can go from there.
So what about the downsides of working in pediatrics? I was thinking when you said that you're also a mother, how tough it might be when you see those really sad, very serious cases.
That's true. We have cases where epilepsy is cured, and then we have cases where patients die or have a really bad outcome or very uncontrolled seizures that we can't do nothing else, right? So that's very difficult. That's a very tough pill to swallow and to digest it. And so to me, I guess it brings a lot of like appreciation for any little progress that our patients may have, right? Because it's really hard. In epilepsy, we have something also called sudden unexplained death of epilepsy, SUDEP. So, kids can just die, right? Even just because they
Mm.
have epilepsy, nobody knows exactly why. A lot of times they can die in their sleep from a seizure. So we do have patients like that because that's all we see,
Yeah.
and that's very hard. That's very difficult. A lot of families keep in touch with us even after, and it's very very difficult. So I don't even know how to say how exactly it influences me. I just know it definitely humbles me in a lot of ways. And it's also a big wake up call because things are urgent because you don't know, right? So we're trying to do as much as we can. And also every time that happens, and maybe it's in every specialty, you always ask yourself, could I like have done something different? Could we
Yeah.
put the device earlier? They didn't come and do this. Maybe if they did this, maybe if they tried this other medication.
But overall, do you feel like, and especially there are more wins than losses? I mean, do the progress and the good outcomes outweigh the negatives of working with kids who might have bad outcomes?
Yeah, I think all overall we definitely have better outcomes. And actually, I think pediatrics has to do a lot with this because kids, they recover faster. They recover faster from surgery, right? They recover faster from any like devices. The neuroplasticity and happens faster, so the outcomes are better. So most patients definitely are doing better after we see them, and we're happy to see that. So yeah,
Yeah.
I think I do have a lot of positives. It's kind of interesting. There are days where you would see patients and everybody would be like, "I'm doing better. I'm doing better. I'm doing better." And then the day will start with someone not doing well, and then everybody comes to like the clinic and they're like, "I'm not doing well. I'm not doing well." I'm like, "But yeah, I see this pattern. In medicine, you start like believing in all these
Yeah.
superstitious things because you never know why things happen." So yeah.
Yeah, no, it's weird. I mean, like you will see something you haven't seen in forever, and then in the next 2 days you'll get like three more cases of that, and then once those days are gone, you'll never see that diagnosis again for years. It's just it's strange how that happens in medicine.
Yeah.
So yeah, so personalities, if people are thinking neurology and specifically thinking about pediatric neurology, are there some personality traits or things that you think people should have to in order to be successful in pediatric neurology?
First of all, it depends on the team and it depends where you work, right? So for me, because I have such a variety of things I'm doing, I don't think it's very typical. I like it just because it gives me this opportunity to do a little bit of everything. But when I asked a few of my friends when we had openings if they would like to come, they actually said no. I'm like, why? I love my job. Why would you not do that? They're like, no, that sounds so overwhelming and horrible that we don't want to do that. I was like, oops, okay, I guess that's true. I get it now. So not everybody. So I think, if you have this environment of fast pace and fast learning, and a lot of challenges, and you okay with this, like for me, it's very stressful. But once I learned, I came up with my own strategies, then it becomes easier, right? So you know how to deal with difficult, parents. And again, calling difficult is just those parents are stressed, right? So they're frustrated. So if you know how
Right.
to talk to them, then you're not stressed about it, right? If you know that different providers have different preferences, you don't stress about it. So you kind of like learn your way around it. And then I think for me, actually, PA school, it prepared me very well for this type of environment because it's very challenging, right? And you have to learn fast, and then you have to like adapt to a lot of things. So I
Yeah.
think, yeah, this definitely has helped because in the beginning it was so much learning, right? So I had to learn so much. And so now after like the adjustment, I'm like, okay, maybe I want to learn more. Maybe I want to do a little bit more. And so I actually did encephalographic course, right? And then I was reading EEGs for a while because I was like, okay, now I learned, so I can learn a little bit more. That's kind of my environment. And if you're outpatient or inpatient, it's still going to be fast paced and it's
Right.
brain. So a lot of times it's urgent or emergent, right? And a lot of times you have to know how to navigate with this. You have to know that you should be scared of certain things and stay calm. So I think personality wise, what I would describe, a person that would maybe enjoy it and succeed is someone who likes fast pace and likes challenges and doesn't mind to do many things at the same time, kind of multitasking, right? So, and for people who prefer something that's more like monotone, more constantly the same, less stress. First of all, maybe not pediatrics, because still those parents are stressed. That's a very
Yeah.
stressful life. But I mean, I guess if you just do clinic, then
Mhm.
maybe it's not that bad, right? So I
Yeah.
think otherwise it just depends. But yeah, I would say
Yeah.
if you like
Yeah.
fast pace, if you like challenge, that will be for you.
Yeah, and I'm hearing what you're saying, but I also think that's one of the great things about specialties, especially like neurology, when there can be so much subspecialization and so many different ways to practice, is that if the specialty interests you, then definitely look around at the different opportunities that are out there and find the environment that fits you best. So definitely when you're interviewing, right, talk to them and like,
Yeah.
what's your vision for me and what do you envision my week to look like? Am I going all different places or am I just working in clinic? And that can help you decide if that job is right for you. That's kind of what I'm hearing you say.
When I had interview, it was very open. And when I was hired, my boss, she told me, okay, this is my expectation. I really, want you to focus mostly on surgical patients because this is the need that we have. And then, besides this, you have like you're gonna have clinicals. And she was like, I'll teach you everything, you learn stuff, but this is kind of how I want you, like I want you to
Yeah.
be there and to be there. So she kind of described how more or less my day would look like. And yeah, and then I had to make my own decision.
So important because a lot of people when you're going to interview and especially when you're coming out of school, it's going to be your first job and you don't necessarily know all the questions to ask and things and you just may be sitting there going, just please hire me, I want a job, when you don't ask all those questions. So really important to really nail down what it is that they're wanting you to do, and also knowing that even if you started off in a neurology practice and you were running like headache clinic or one of the other autism clinics or whatever, there could be opportunities to move to a different clinic or to expand what you're doing or change what you're doing. So we've talked a lot about pediatric neurology, and I always say this: money is not everything, and I don't think anyone should pick their specialty based on the money, but people do like to, have an idea of what a specialty pays because sometimes it's hard to know that information. So, can you give us some kind of idea what people can expect in pediatric neurology, understanding that this is going to be variable across the country?
Yeah, I think the range is probably like any other specialty from like 100 to 150. And it depends where you are, right? What exactly you're doing, and then your years of experience. So I really don't think it's any different from other specialties, except I think surgical specialties usually make more higher salaries. And then, yeah, we're not considered surgical, so we're in that range.
And so, if somebody's watching this and they're in PA school or they're contemplating going to PA school, what rotations do you think would be helpful?
Neurology or neurosurgery, either pediatric or adult. I truly didn't think specifics, but it just happened that my electives were neurosurgery and neurology. And I think neurosurgery, I had two, one adult and one pediatrics. And another interesting thing that happened to me is that at the same time when I was offered this job, I was offered a job in the other location, and I was approached by a recruiter. And I was surprised because I'm a new graduate. Why am I approached by a recruiter to go and work in pediatric epilepsy? Makes no sense, right? And then I asked her, well, I didn't ask her. I think she told me, hey, we saw your resume because, I applied and like I put my resume out there. And I saw that you had quite a few, neurology and neurosurgery rotation that we like, that you had this experience, and that's why we want to offer you an interview. So I think that's helpful, not only if you're thinking about it, but also probably for recruiters to find you if you want that
Yeah.
field.
That's a great tip if what you might be interested in, and you can get those rotations. So I wonder also about resources, or like say somebody is already practicing, they've graduated, they practiced for a while, and they are really thinking about moving into pediatric neurology, are there resources that you could point people to, either books or websites or societies that would be helpful?
American Epilepsy Society, that's specifically for epilepsy, that's really good resource, and they have all kinds of literature and resources there. CNS is a Child Neurology Society, so I think this would be two main resources that can lead you to everything else. Yeah.
And then you went into this as a new grad, right? This was your first job out of PA school. Looking back, is that something you would recommend? Do you think that was a good move? Because the debate is always people say, well, maybe I should go to family practice or something and get like a good year or so of general medical practice before I go into a specialty. And then I've talked to other people that went into specialty and they're like, no, just go into the specialty if you're interested in it. What are your thoughts on that?
I think go ahead and go where whatever interests you because you never know. And again, there are so many other variables that will influence your decision, right? So, and the biggest one still team, right? You can be in specialty you love, you're gonna start hating it if your team is horrible, if you don't get a good mentor, right? So for me, I think maybe if I went in something different and I had a good mentor, again, it doesn't matter what it would be. Now I
Yeah.
can't imagine something different because I'm already right, specialized in this and I'm already an expert in this. So I love it, right? Because okay, now I know all these things.
Right.
But in the beginning, you really want that environment where it's welcoming, where you can learn without judgment, you have time to learn, where you get to the point where you're comfortable to actually have that autonomy and then have that respect and then kind of get and
Yeah.
then actually be confident in giving the care that you want to give. So yeah, I would
Yeah.
say I don't think that you should go somewhere else to learn family medicine and then go to specialty because here we don't just learn neurology, right? So we still see patients with all kind of comorbidities. So we still learn a little bit of endocrine, a little bit of this, a little bit of this, right, with
Yeah.
time. So, and that helps, but we send them to other specialties because we understand that.
All right. I think we've talked about most things about pediatric neurology. Anything else that you want to say?
If you decide that this is the route you want to go, like if you want to go to neurology, then try to learn as much as you can, try to see if you can find a good mentor. I think it's very, very important. And I never really looked for a mentor. I don't think so. I just happened to have someone I really liked and she became a mentor, and she actually is younger than me. She's in neurosurgery and she was the first person that told me if they didn't pay me for that, I would still come to work like as a hobby. That's how much I love it, right? And I mean, probably it's not
Yeah.
necessarily true, right? But in a way, what she was trying to say, I love it so much, and it's so fascinating, and it's just so rewarding that I would still like. I just come to work like, and it's so pleasant. So I think you have to find if that's really what fascinates you, if that's really what you want to focus on, and you want to go that route, then do it. If that's not really what makes you feel excited, then maybe rethink, is that really what I want to do?
Right.
Yeah.
Yeah. Yeah. Great advice. Well, thank you so much, Olga. I really appreciate your time and for telling us all about pediatric neurology.
Thank you for having me.
Now, if the brain fascinates you and you think neurology might be right for you, but you're not sure about peds and you're kind of curious about adult neurology, or maybe you're even thinking about neurosurgery, then check out these videos here. Thanks for watching. And as always, take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.